I don't care which one it is, but take your meds, okay?
Okay.
Okay, so which one do you have?
Well, this is the one that I've been prescribed by you.
Okay.
This is the one that I literally want to get.
Are you taking this one right now?
I'm going to be purchasing it.
Okay, so, but why not take this one? This is empty?
Those are empty, but I did find literally. So I was prescribed by this, Sapna, and then these, anyway.
So what's the difference between what we gave you and what this is? So this is what you like?
Yes, because it reduces tumors. It
Okay.
reduces,
But that's one ours also, no?
well, it's
So
available,
this is from India?
online. It's available online now.
Okay, is this from India or something? No.
I actually was prescribed that by Dr. Sapna at Arrowhead.
Okay. Okay, I'm trying to see who manufactures this one. So once you get started on it, so you're not on any medication right now?
Well, I've been on antibiotics.
Okay, no, like CML directed treatment. Are you taking anything?
I'm waiting to get the correct one.
When is that going to come?
On the internet.
How long is it going to take?
I just need to literally get some disability money coming in.
So money is the problem right now. So take this one.
Yes.
Take what you have.
That one's empty.
Okay.
But that's proof of the fact that I have been prescribed it before.
Yeah, no, I don't, kind of discount that you have not been prescribed it, but can I see the other one that you don't like? The one that you just.
All right, this one.
So what's wrong with this? This is exactly the same packaging. Everything is the same.
This is actually the reading material for the one that I do
Okay.
like. And it literally says that it reduces the tumor sizes.
But you don't have
This
tumors.
one. I do have a pain in my breast, and it literally makes it go away.
Okay. So
there's that as well.
So
And
this doesn't say it?
This is the reading material that from the one that I was prescribed.
So
And this one does not say, but what it does say, in a particular way of saying it, is that ulcer perforation, meaning it creates ulcers and literally the problem that I do not like, which is pain in my breasts. It's just another way of saying it, but it's not another way of saying it. I'm so sorry. It's a way of saying something else that it starts breast tumors. And I'm very sensitive to this, to breast tumors. I literally have some in my breasts that have gone away with the correct Tasigna.
Are you on disability?
I'm looking to get on disability.
Who's paying you? Who's writing for that disability?
I'm literally.
Your family doctor is helping you with that?
I have not done that yet. I was literally looking into reading material.
So I think, did you get a letter from us, like a warning letter or something?
No.
Okay, so there was some talk of potentially sending a warning letter because we want you to, follow the recommendations from the medical team and such. You understand you have to check out for whatever reasons. And I know you wrote me, something in the portal.
I don't have patient portal. My sister had that though, and she literally closed it down and then later said that she never had patient portal for me.
Okay. So, Diwan, the issue is this that, we have been trying to reason with you, but you are following your own, and it's your conviction, and you believe in what from my standpoint, there is no difference between the two medications, but you firmly believe that one works and the other one does not. So there's fundamental difference between what we are telling you and what you understand. So that makes care very difficult. So because right now you are following your own advice, or so in that situation,
well, I'm following my own experience with two prior
which
doctors.
which is fine, right? Yeah, but then it makes it difficult. Okay, please come in.
Do you want me to stay or do you want me to sit over here? I'll be out in a bit.
Is that your mom? Hi.
Hi.
How are you? Good to see you again.
A lot of rain.
I know. Okay. Alright. So Dion, this is the issue that if you cannot agree on what needs to be done, you need to find a different physician.
Okay.
Yeah.
All right.
So Dr. Mehta, do you feel comfortable with her?
She's a very good doctor.
Yeah.
She's on the East Coast now.
Oh, so she left. Okay.
Yes, I'm not quite sure if there is a way for me to get a hold of her.
But you need to find a physician who kind of believes in what you say. For me, it's a little bit hard. I go with the evidence, and I know you've done your research, but we treat patients with CML, And these are very common medications that we prescribe between one class, and I know you've had reactions to medications in the past, but it's been really hard to get your CML under control, and there's some social issues also. You live far, we cannot monitor you that closely, so I'm not sure if it's going to be a good fit or not for you to continue over here. Don't get me wrong, I'm happy to see you. The only problem is that we cannot get you to follow our advice, and you have your firm reasons for not believing it. And if there's a disagreement between physician and patient, then I think that makes care a little bit challenging. And if your blood counts were okay, that would not have been a problem. But your counts are dangerously high. So even today, your WBC is 180. It's very, very scary.
Right.
I know you feel well, you've lived with those counts for a long period of time, but you need to find a physician who believes in what you're saying. I do not believe it. Not to say that you don't believe it, and it's your firm belief, but so there's some disagreement as to.
I was vaping
Okay.
while I was at home,
Okay.
just for stress relief.
Yeah.
Not cigarettes, but
Yeah.
a vaporizer.
That's fine.
I believe it might have a contaminant in it
Okay.
that tastes like somewhat saliva.
But we're diverting from the point. So the point
Right.
is what you have to, you have to pick a medicine and then stick to it. So how do you want me to proceed? How can I help you?
Is there any
Because
way?
you are self-medicating, you take your medications when you feel like, or sometimes there's long gaps where you don't take it.
Well,
So I don't think I'm helping you.
only because I've been trying to get a hold of this particular medication.
Okay.
This is a specific.
Which is fine.
This is
like
brand
sometimes,
new.
yeah.
The card is completely different. I was even told that it's ordered specially.
Okay.
When
do you think you'll be able to get it?
From doctors here?
Yeah.
When could I get it? It all depends upon having money to
possible.
purchase it.
Like in a month, you'll be able to get it?
I am going to try.
So what if you don't have it in a month's time? Will you take what you have right now?
Well, I'm definitely not going to be taking this because there's so much
Because of what you read.
regarding the
that's
fact
essentially-
that it actually causes so many problems.
Yeah.
And enterocolitis, that's literally something that's featured very heavily on the internet right now.
Mm-hmm.
So it's very worrying and it's upsetting
Mm-hmm.
for a lot of
So
people.
how can I help
So,
you? I'm just trying to figure out, Devon, how can I help you?
because
Because I'm not helping you right now. Right?
Right.
Yeah.
I was wondering, is there any way that I could get a hold of, say, this medication through you?
How can, we just send the medication to the pharmacy, and then the pharmacy decides which is available in stock. So we do not control. It's literally the same medicine. The brand name is the same, Tasigna. There's one manufacturer, I think it's Novartis, which makes Tasigna.
Yeah.
So I don't know what's special about the other one.
Well, say for example, Amber Pharmacy. Would I just have to get a hold of Amber Pharmacy
Yes.
to get to see if they could literally fill
Mm-hmm.
the order of this specific kind of Tasigna?
Mm-hmm.
If I can even do it through that way.
Mm-hmm. What I can do is I can send a prescription to Amber Pharmacy and see if that helps you.
Of this specific kind?
Yeah, it's the same thing, right? The Signa, I'm just going to put the Signa. Now, I don't know what's different between this one. This is the one you don't like?
Correct. I don't.
So
like
what's
this
the difference? Tell me the
one.
difference.
Well, for one,
No, like nilotinib or some that kind of thing.
well, there's two different specific
salts.
guides that come
Hmm?
along. Well, there's one for each. So
No, tell me what's the difference. So typically this is the trade name and this is the the generic name. Okay, so it's the same one, nilotinib and nilotinib. So it's the same pill. It's like if you ask me, it's no different.
Well, like say for example, this specific.
Okay, what I'll do for you,
reading
Devon, is I have Amber Pharmacy over here. I'll send a prescription for nilotinib. The dose is 300 twice a day.
Well, wait. Is it for the specific kind now?
I'm just going to put Tasigna. I don't know what. That's what I'm trying to say. What is different between these two?
Well, this one is causing problems, and this one.
Okay, so
doesn't
let's do
cause
this, Devon.
problems.
So say that the doctor sent you a prescription, and then go to them. Say I want this type, and they may be able to get you this type.
So if you put that through,
Mm-hmm.
is it going to be more of this?
I don't know,
Oh my
because
gosh.
in my thing it's the same. So then once the order is there, then you call the pharmacy. Say my doctor sent the prescription. I want this particular, and then they might get you this particular one.
Uh,
Because if you tell me here what is the difference, I can put it over here. I don't see what the difference is. See,
well,
no, it's made by Novartis. This
yes,
is also made by Novartis in
I-
the same company.
I am seeing that.
So I'm gonna send it right now.
Well,
You call the.
I'm actually thinking of calling them myself.
Yeah. So, but they need to have a prescription, right? So now the prescription is there and it's active. So now make this call to them. Say that on this particular date
Did you
give me
scan
this.
it?
No, I can't scan it. I can send the order, but then when you go to pick up, say I want this thing.
But I have done that before and it doesn't work.
So then.
Because they always ask me to go back to the doctor and literally talk to.
So then tell me what should I put in there that makes it. I can't scan it.
Okay, well, how about I'm just going to go ahead and do this myself. Can you not put that through?
It went already, but I can cancel it.
Could you please?
Okay. Cancel.
What was the reading material on that, by the way?
Say again?
Do you mind if I look at? Is that just for that particular Tasigna? Is it this particular card?
I don't know. I don't know what the difference is. I'm just doing it because you feel comfortable with that one. So send it over there. In my book, both are the same. There's no difference.
I also have another question. You don't happen to have on hand any particular Tasigna that is like this thing?
I wish I would have had samples, but these days we don't carry samples. Like in the old days, the physicians had samples. Is that what you're saying?
This is something that should be more on hand for everyone, honestly.
No, they don't encourage it because we can only give you supply of 7 days. You need like a lifelong supply, right? It's best if it comes through pharmacy.
There should be a giant supply for every hospital, literally. Of the correct kind, because it's very dangerous taking medications.
Yeah, I can tell you, I give this medicine every day to patients. They do okay. I'm telling you, they won't. Okay, but anyways, I don't want to kind of waste your time and mine as well.
Right.
So, how can I help you? So you didn't want me to send the prescription. I did not send it. So what can I do to help you?
I guess what I'm going to do is, could I ask for copies of my blood lab reports?
You absolutely can. We'll give you copies of the lab report.
Okay.
One copy. And then we make photocopies, okay?
Okay.
Oh.
And then I guess I'll just schedule another appointment for about a month out.
Are you willing to come?
Yes.
I want to make sure that you are taking medication and then I see you, okay? So let me make another appointment in a month's time, and then I'm hoping your disability check comes in, you get the right medication, and then we go from there, okay?
Okay.
I'm going to mention all this, that there is some non-compliance, that these are my recommendations, but we're not able to find common ground. This, I have to document it for my legal protection and such, because your counts are really high, Devon, so it's kind of...
What would bring it down, though, and that's just from personal experience,
What about
is
hydria? Yeah, no, that's fine, and you believe what you believe.
I have enough of that.
Okay. Are you taking hydria?
Yes.
But
I mean, I will, just not,
Okay.
I have a particular kind at home
Okay.
that's a little bit older,
Okay,
that literally actually does bring down the WBC,
got it.
and I will be doing that. However, I can't utilize that without understanding that it does drop the immune system, for which that is why antibiotic is used. However,
So your
when
immune systems are bad. So I'm just going to make one point. Your immune system is bad because of CML.
Right, exactly. Right. I do know that. So.
Okay. Good. So I don't want this to be confrontational and such. You have your firm beliefs, and I don't want to discount that. But I have to kind of give you the recommendations which I believe are true. I can have my belief, you can have your belief, but then am I helping you out by? Let's have you come back in a month's time, Devon, and then go from there. Okay.
Okay.
What else can I? How's your belly pain doing?
Well, it's.
I think you had C. diff colitis, right? Yeah.
I stick to a lot of vegan.
Vegan, okay, good. That's a good diet.
And it does get rid of some of what I thought was the bowel obstruction
Okay, good.
and blockages, but I had to do a little bit of reading to
Are you
understand that it's
having-
enlarged, like the doctor said before.
Yeah,
She said it's
spleen.
in an enlarged spleen.
Can you look?
Yeah, but that goes away. Can you press right here?
Okay, you'll have to pull this picture up a little bit.
I'm a little bit sweaty because of nervousness.
No problem. Why, you get nervous with us? Okay, let go.
Right here,
I'll
sorry.
feel it, yeah.
There, okay.
There you are, Sweaty, and this sweating can also be because of this, it's hard to calculate. But at least on the CT scan, the spleen was enlarged. Yeah.
You see how it's hard though?
Yeah, that's the spleen that gets hard, yeah.
This side's squishier.
Yeah, because there's no spleen is on the left side.
well, it has this particular hardening of the organs or whatever it really
Spleen,
is.
yeah. So there's
Hardening of
spleen
the
over there.
spleen.
Yeah, yeah.
Okay, I thought it was also the liver.
Liver is on the other side.
Oh.
Let me show you.
Well, I actually gave myself a way worse condition of what I have now.
What do you give yourself?
About a year and a half ago, 2 years ago, when I had an encounter with a low-income dentist from Joshua Tree. I literally called Medi-Cal, and the first dentist that they suggested was right down in Joshua Tree, just 5 minutes away from my house.
What does that have to do with the spleen?
Because of all of the acyclovir, varicyclovir, all of the antivirals that I was put on, it made my chest cavity really extended out, and also, of course, the lower gut. And then all of this particular area was all hard. I had about 3 cards left of this kind.
The one that you like?
Yes, and it got rid of literally a lot of it.
Okay, I want you to look over here. So you have to look at CT scans before. Okay, so these are your lungs. That's right, that's left. This is back, this is front. Okay, that's your heart over here. And we go down. This is right side, so the liver comes over here and the spleen comes over here. Okay, so we're going from top to bottom. We're going down at the lower part of the chest. Your lungs are looking okay, and that's your liver coming up. Okay, and then the spleen is going to show up over here. So that's your. It's a pretty big spleen actually. The spleen is huge.
What is the white cloudy stuff?
That's the liver. That's the liver, the heart, and the spleen. And you see, normally the spleens are pretty small. So the reason why, so this whole organ you see, that's the spleen. And it goes down, 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 still coming up. So all that pain that you see, this is a huge spleen. All the pain, it goes down all the way down to your pelvis now. And you're also all this thing that you see, that's all stool. So you're constipated, your liver is enlarged, your spleen is enlarged. So that's what your uterus is okay. So it's just that this large spleen which is causing the problem. And why is the spleen enlarged? Because of your CML. So if you take your pills, it'll shrink your liver and spleen, and you feel much better.
Once I purchased the correct kind, because I literally was able to I had 3 cards left that I found, and this was about 2 years ago.
Okay.
And I literally got rid of a giant, huge chest cavity. I'm really not lying.
Chest in the belly?
This area was extended and protruded, and so is this.
I won't say I don't believe you, but it's a little bit hard. But that's your experience, so I'm not gonna.
It also got rid of the pain in my breasts as well.
Oh, okay. But pick a medicine, take it. I don't care which one it is, but you have to take some kind of medication. Okay. All right. Take care.
All right.
We'll see you back in a month's time. I'll put the orders in. Okay. All right. Take care.
But you're not going to order this though, right?
I can't. I don't know how to order it.
You're not going to order that one?
I don't know how to order it. See, I just put this one. When we do orders.
You put this in again? You put this in?
I'll do it again.
Oh no.
Say again?
Oh no, please.
No, I took it off, right? We put it in and then you said you don't want me, so I took it off.
Yes, I'm just going to buy this kind online.
Okay, no problem. I won't put it in, so just buy it online.
Okay.
Come see me in a month's time, and then if it's working or not, we can judge by the blood counts. Okay?
All right. Thank you so much.
Right, you're welcome.
Okay.
I know. We got